Welcome back to Surgery and Anaesthesia. Have you ever noticed that Xylocard, the intravenous form of lignocaine, is always labeled preservative-free, but the regular lignocaine used for local anesthesia contains a preservative called methylparaben. Let's find out why. Because the reason is really important for every doctor, nurse, and anesthesia student. First, what exactly is methylparaben? It's a chemical preservative added to many medical and cosmetic products to prevent bacterial and fungal growth. In multi-dose vial of lignocaine, like the ones used for infiltration or nerve blocks, each time you insert a needle, there is a small risk of contamination. To prevent that, manufacturers add 0.1% methylparaben as a preservative. It keeps the solution sterile and stable for multiple use. Now, let's talk about Xylocard. This is lignocaine hydrochloride meant for intravenous use. Because it goes directly into the bloodstream, every ingredient must be 100% safe for systemic circulation. Preservatives like methylparaben, when injected intravenously, can break down into para-aminobenzoic acid, that is PABA, which may trigger allergic reactions, interfere with sulfonamide antibiotics, or in rare cases cause toxic effects on the heart or nervous system. That's why regulatory authorities like the USP and British Pharmacopoeia strictly states that preservatives must not be present in intravenous preparations, epidural or spinal injections, and ophthalmic solutions. So, here's the logic. Local anesthetic vials used multiple times need preservatives to stay sterile, while Xylocard, used only once directly into a vein, is a single-use sterile vial, so no preservative is needed. Simple as that. This difference is not just theoretical, it's clinically vital. If you accidentally use preserved lignocaine for an epidural or spinal block, the methylparaben inside can cause neurotoxicity or arachnoiditis. That's why all spinal, epidural, and IV injections must always be labeled preservative-free. So let's recap. Methylparaben is added to multi-dose local anesthetic vials to prevent contamination. It's not added in Xylocard because preservatives can cause allergic or toxic reactions when given IV. Xylocard is single-use and preservative-free to ensure complete safety for intravenous administration. And that's why the mystery is solved. Now you know exactly why Xylocard has no preservative while other local anesthetics do. If you found this video helpful, don't forget to like, share and subscribe to Surgery and Anaesthesia for more quick medical explanations that actually make sense. Thank you so much for watching.